Hello dear learners, in continuation to our module quercetin. Quercetin is one of the important bioflavonoids present in more than 20 plant material and which is known for its anti-inflammatory, anti-hypertensive, vasodilator effect. It has also shown anti-obesity, anti-hypercholesteremic and anti-atherosclerotic activity. Free radicals are one of the key factors for the development of disease such as hypertension, vascular disorders and metabolic syndrome. The objective of this module is to elicit the health benefits of quercetin and also explore the opportunity as functional food or nutraceutical product development through quercetin. Let's begin with the health benefits of quercetin. First is anti-inflammatory effect. When the part of the human body is exposed to harmful or irritating stimuli, there is a biological response called inflammation which plays a role in self-protection. The aim is to remove damaged cell, pathogens or any harmful stimuli and begin the healing process. Inflammation does not necessarily mean infection. In most cases, infection is caused by a virus, bacteria or fungus, while inflammation process is the body's response trying to heal itself. One of the core most remarkable property of quercetin is its ability to modulate inflammation. Quercetin inhibits inflammatory enzymes, cyclooxygenase and lipooxygenase, thereby decreasing inflammatory mediators such as prostaglandins and leukotrienes. Nutrition scientists from Michigan State University explored the impact of dietary flavonoids such as quercetin in their general roles as systemic anti-inflammatory agent. Elevated C-reactive protein levels were associated with numerous disease states such as obesity, heart disease and lupus. It has been identified through many studies that intake of certain foods can lower the levels of inflammatory marker factor. In the preclinical in vitro studies, quercetin showed a significant reduction in the level of inflammatory mediators such as no synthase, cyclooxygenase 2 and C-reactive protein in human hepatocyte-derived cell line. In rats, quercetin doses equivalent to 80 mg inhibited both acute and chronic inflammation and showed significant anti-arthritic activity against adjuvant-induced arthritis. Let's now study antiviral effect. Quercetin has been reported to be effective against viruses. It possesses antiviral activity against enveloped virus such as herpes, simplex type 1 and parainfluenza type 3. It was also proved to be protective from the cardiovirus. The antiviral activity of quercetin was due to its ability to bind to viral coat protein and polymerase. The mutagenic, carcinogenic and anti-carcinogenic activity of quercetin was found to be related to its ability to impose or prevent damage to DNA. It was reported that on stabilization of quercetin with ascorbate, it enhances its antiviral activity, which was similar to the effect induced by ascorbate enhanced anti-proliferative effect on squamous cell carcinoma. Quercetin was also proved to enhance the antiviral activity of agents like interferon and 5-degree ethyl 2-dioxyuridine. Cardiovascular protection. Quercetin inhibits the platelet aggregation and improves the health of endothelium. In addition to that, it also protects against coronary heart disease and reduces the risk of mortality caused by low density lipoprotein. It is known to exhibit important vasorelaxant properties on isolated arteries which help to lower blood pressure and prevent the development of cardiac hypertrophy. In one of the study, it was reported that consumption of quercetin dose of 150 mg per day reduced systolic blood pressure and plasma oxidized LDL levels in overweight subjects who were at high risk of heart disease in a 6-week clinical trial. Quercetin has a specific feature which inhibits fat accumulation in maturing human fat cell and simultaneously triggered apoptosis in existing fat cell. In addition, quercetin also blocks the uptake of glucose from the blood and blocks the fat cell production and enhance fat cell necrosis. Neuroprotective effect. Quercetin along with ascorbic acid reduces the incidence of oxidative damage to human lymphocyte and neurovascular structure in skin and inhibits damage to neurons. It is known to protect brain cell against oxidative stress which damage tissue leading to Alzheimer and other neurological condition. Flavonoids believed to play a crucial role to protect neuronal injury. Flavonoids exert neuroprotective action within the brain, including a potential to protect neurons against injury induced by neurotoxin. It is also has additional ability to suppress neuroinflammation and promote memory, learning and cognitive function. Quercetin was reported to have decreased the 6-hydroxydopamine and induced oxidative stress in the neurons of brain stratum of rat. In another study, it was reported that quercetin treatment affected the working of nervous system by depleting the intracellular glutathione contents. Learners, let's now learn anti-cancer activity. Cancer has been found in 60 different parts of human body and currently requires new therapeutics for its treatment. Quercetin has been reported as potent anti-cancer agent during in vitro studies in various cancer cell lines and in vivo studies in rodent, especially mice. Quercetin has radical scavenging potential, therefore it is capable of preventing cancer induced by oxidative stress. The chemoprotective action of quercetin through apoptosis and metastasis against tumor cell lines makes it a strong candidate as a potential anti-cancer agent. Moreover, quercetin in the combination with intratumoral doxorubicin injection has been reported to result in enhancing immune response against growth in breast cancer tumors. Ulcer and gastritis. Studies have shown that quercetin inhibits gastric acid secretion and lipid peroxidation of gastric cell, and they thereby serve as gastroprotective agent. It also inhibits Helicobacter pylori infection. The ulcer activity of quercetin is due to its free radical scavenging properties or its increased gastric mucus production. The clinical effect: quercetin is claimed to be exert many beneficial effects on health, including protection against various diseases such as osteoporosis, lung cancer, and cardiovascular diseases. Studies have shown that there has been a reduction in the risk of cardiovascular disease in the subjects who had a high intake of flavonoids. Progressive disorder of lung, parenchyma and airways, also known as chronic obstructive pulmonary disease, happens to be the third leading cause of death in most countries. Therapies thus far for COPD, unfortunately, is said to be partially effective with possibilities of side effects. Increasing evidence indicate that quercetin supplementation may be beneficial in its treating this condition. Let's now understand the perspectives of quercetin in product development. Several studies have shown that higher doses of quercetin, more than 200 micromole, reduced the cell viability, but low doses of quercetin less than 200 micromole was reported to increase the cell viability and to be fixed as therapeutic dose. It was reported that low dose of quercetin also resulted in the inhibition of proliferation of breast cancer cell, mild cytotoxic effect, and also induced mild DNA damage. The fruit and vegetable consumption was reported to contribute to an average of 15 mg to 40 mg of quercetin per day from the diet. It was suggested that increase in quercetin intake could be accomplished by increasing the consumption of more fruits and vegetables. Therapeutic doses of quercetin intake were denoted to range from 250 mg to 500 mg 3 times per day. Quercetin is generally available in the form of capsule or tablets ranging in doses from 50 mg to 500 mg as a dietary supplement. The doses of quercetin has been recommended based on health condition to be treated, and no standard dose for quercetin has been suggested. It was reported that low dose of quercetin was sufficient to inhibit the proliferation of breast cancer cell, mild toxic effect, and to induce mild DNA damage. At present, limited data is available on availability of quercetin food products in the market. However, as stated above, it is available in the form of tablets as dietary supplement. It can be stated here that further research is required to develop the food products containing the extract of quercetin. Let's conclude, learners. Quercetin is a flavonoid, has been proved to be a powerful antioxidant which can be derived from raw foods such as fruits, vegetable, cocoa, tea, coffee, to name few. Quercetin is also known to provide various health properties for human health as antioxidant, anti-inflammatory agent, antiviral activity, cardioprotective, and anti-cancer effect. The health benefit of quercetin can be preserved in the processed food by adapting less intense and non-aggressive processes. The uses of quercetin for its antioxidative and anti-inflammatory property has been well established. Interestingly, there were the two effects of quercetin which has been widely dealt to combat oxidative stress and inflammation.